if you're headed out and about. In today's news for you, fighting prostate cancer before you get it. Dr. Tom Edmunds is a urologist at Capitol Urology. He's going to be one of the lecturers coming up for some Palmetto Health free screenings. I'll give you details on that in a minute. One thing that amazes me, though, doctor, is that prostate cancer, our statistics show it can kill more people than the leading lung cancer. But prostate cancer is prevented. Can be prevented, right?
Can be prevented. If you have early screening and early diagnosis, the majority of the patients do not die of the disease.
And you're going to be speaking to a lot of men coming up. What is the main thing you want to get across to them?
At age 40, and I still think all men at age 40 should get screened at least baseline with a PSA and an exam to make sure they're not at risk. If they have a first degree relative, their father or their brother with it, that significantly increases their risk.
And you say all men because it actually can change as far as when you get screenings depending on if you're a white or black man, right?
Right. The incidence in black men is 60% higher than in white men, and Asians have a less of an incidence than the others.
And you were educating me during the commercial that a possible link between STDs, these sexually transmitted diseases, and prostate cancer later in life.
That's one of the theories on it because it may be an inflammatory process. But there are genetic factors, economical factors, access to care, and environmental factors that certainly play a role.
How tough is it to have a screening? Because let's face it, you're talking prostate, right?
Oh, it takes 5 minutes. You get blood drawn, get a PSA drawn, and then have a doctor that checks your prostate.
Okay, and then in addition to the actual screening, you will actually speak to them
Sure.
for about an hour or so and take their questions and help them through.
Sure, I give a whole little presentation on prostate cancer, and really a lot of times some of my patients will show up and they'll just stand up and say, hey, I had it, and look at me, I'm okay.
Which is really key.
Oh, it's great.
To let them know they can
It's
be
great.
okay. He's being so reserved now, but believe me, knowing this doctor personally, it'll probably be a fun seminar. So let me give you the information here. The screening and seminar, the first one coming up where Dr. Tom will be is next Wednesday, the 25th, from 10:30 to 1:30, and that includes the screening first and then the seminar where the doctor will be speaking. That's at Palmetto Health Richland, and the first part is in Classroom 1B. Then you go to the auditorium for the lecture and a free lunch. Then the screening and seminar later on Saturday will be from 10:30 to 1:30 at Palmetto Health Baptist. You see where to meet there, free lunch as well. All these details and a lot more are on our Big Red 10 because this is a lot of to catch here, so I've already got it on our website for you. Watch me, follow me on Twitter. Information will be there after the show. And my Facebook page, Dawndy Mercer Plank, WISTV.com. You will see the interview with Dr. Edmunds there as well. Thank you, doctor, as always.
My pleasure.
Appreciate it. Time now to get a check of your forecast. For that, we turn to our chief meteorologist. Say his name, throw it to him.
John Farley.
All right, that's